Well, this is a Tuesday. We're recording this week. Tim was just taking its break for lunch. Your diary got really clogged on Monday in the end, didn't it? But I think this is, well, it doesn't matter which day we do it. There's so many things going on in the world. The big one that I've seen, and obviously the newspapers have reported about this person that's jet skied into the Isle of Man. I mean, it went through the system, and that's why it's come public. What can you tell us about that? Because it sounds like a real bit of a scary loophole that people can just get on at some means of transport, come here, and then they're completely, obviously, outside the system, if like this person was anyway.
Well, this person was caught, Paul, so
yes.
I think we need to emphasise on that. It's resulted in the person ended up in Derby. I don't receive any additional information. Obviously, it was a police matter. It's dealt with by the police. As a minister, I don't get any special access to any information in relation to criminal cases, so I know just as much as the Manx public do in relation to this. Reading
the write-up, he went into nightclubs and that sort of thing. Wouldn't at that stage, when it was found out, wouldn't all those people in the nightclub have to be contact traced and told to self-isolate because of that potential danger?
If he had proved positive, because my understanding is he was tested and he hasn't got, the virus, so obviously contact tracing is something that takes place after someone is proved positive.
So that could be a nightmare, or there's always that potential.
There is, and that's why people need to act responsibly, as we've said throughout. Mm-hmm. You know, it only takes one person to cause a serious issue that then has wider repercussions across the island. Okay, I'm going back onto vaccines now. You know me, we had a little sparring match each time about this. Where are they? When's it happening? And why is it not underway right now? So the vaccine, well, first thing is we're going to do it right. So it's not going to be rushed, it's going to be done right. The vaccines, I believe, are due to arrive imminently, and it will be this week that the first tray will arrive. And as I said at the press conference on Thursday, we will then look to start the immunisation with the first of the care homes starting next Monday. Yeah, I thought you said that, I have to be very careful listening to you word for word, because that's behind what you said originally, isn't it? We're now 2 weeks behind where we initially should have been, because as soon as the UK was going to get the vaccine, we should have got it because it's handed out to all the areas and that sort of thing. No, I said we would get our share of the population, which we will. Our plan has always been to start the programme before Christmas, and that was the phrase that we always put out. But Jersey and Guernsey have got some, haven't they? And you didn't know about Guernsey, I think, when that last press conference. Yeah, I believe Guernsey has as well. What's going on? Why have they got it? To roll out. Well, they've got it exactly the same as us. They've got it already. But also, don't forget, they're closer to Belgium and the actual stuff coming in. No, because we've got to remember. Seriously, we've got to remember logistically with this vaccine, it is very, very hard to transport. It cannot be shaken. So even when it is at the -70, the vaccine cannot be shaken. If the vaccine is in any way shaken during transport, it is absolutely useless. Mm-hmm. So logistically transporting this and then storing it is a nightmare. So we are on course to actually start our vaccination programme starting next week. There's nothing I've seen that would throw that off kilter, and then we'll start rolling out from there. The other thing is we do have a bit of a luxury here in the island, and the fact at the moment we don't have any community transmission, and so that makes it a bit easier for us to start rolling out. That's a conspiracy theorist thing on this, isn't it? Because basically when they're sitting in the UK and they're putting the piles, they're going, the Isle of Man doesn't need it. I mean, they've got no cases. No. There's no rush to give it to them over there. They're all right, Jack. No, that's absolute nonsense. We will be receiving our supply based on our population. You've got to remember as well, the UK received less than they were expecting. They were expecting 800,000 doses in the first batch of delivery of the Pfizer vaccine. They didn't receive that. So the amounts that threw off the delivery targets as to what the UK would actually transport. So it'll arrive here this week, and by plane, you think now? It will be by plane. And then we'll have a photo op. Will be the first person having in a care home having the vaccine put in? That would be up to the care home, and it would be up to the individual as well, because obviously we would require their consent to be able to do that. Everyone else is having a photo op. I think we can have a photo op. If the individual gives consent. Yeah, I know, but come on. Yes, we can. Yeah, okay. But I think it's important to see that we're getting it. I think it's important we do, and I think that it's also important that we put out the messages around why the vaccine is so important and why it's important that people take it. Okay. Now, the nursing homes, the first batch goes, and whatever, the vulnerable people are in homes particularly, I suppose, are getting care and attention. So at what point does it have to move to having this central hub online? Because I've been pushing for you for some time to tell us where it is even. So that's after the care workers. So months? You've got the care home So the central hub would probably be in about 5-6 weeks' time, where we need to start getting
that'd be the new year, right?
Yes, it'll be well into the new year before that actually happens.
So you're not telling me, for some reason, I'm now triangulated. Various people have given me a place. I mean, I can mention it.
Yeah, you can mention where you've been.
Okay, because it's not where I thought. This is interesting. Well, it'll be interesting to see if I'm right, won't it?
Well, it will, because
I won't
be able to tell you. But you can mention. You're a journalist, Paul. You can quite happily mention where you've been told.
See if I'm right or wrong with this scoop or not, because it's not where I thought. Right, the airport. That's all I need to say, and we'll find out if I'm right. But and the reason I've been told is it has to be somewhere inside and contained. It's therefore that's what ruled out the TT grandstand. You play a good game of poker there, I can see. No sign of anything.
We're not ready to announce yet where it's going to be.
It will be one place because
it'll be one place, one central hub. We have we may work with the GP surgeries to deliver some within the surgery environment, but that's still being negotiated at the moment. In relation to the central hub, we need to get the logistics sorted out. There's been several places under consideration for that, and once we've got all those logistics in place, we've spoken to the staff.
Why is it top secret,
who are delivering. Well, it's not top secret. There's several places under consideration.
Oh, so it's not finalised.
What we need to do is make sure that we've got the appropriate bays, first of all, for people to be vaccinated in, to be able to get the throughput of people through. We need to have areas as well, as Henrietta, the Director of Public Health, spoke about at the press conference, to ensure people can be monitored if they need to be monitored after the vaccine, and also speak to the staff who are delivering this on the ground. It's not just like a production line. At the end of the day, this is a clinical environment, and it's important that the clinicians involved in the vaccination programme have input into this.
Bear with me, imagine it is the airport, because you're not going to say anything, but people from Ramsey or further north, this is quite a hike, especially if they're relying on public transport to get there.
Well, there will be special services, I believe, we're looking to try and arrange wherever
to Romsey
may be, to be able to provide transport.
Okay.